Okay, my talk is on radiology education. Mentors seem to be what's in style now. The Medical College of Georgia uses mentors for their radiology residents. They watch them read films. They are able to follow them around and ask questions. We at Brunswick Hospital have Medical College of Georgia residents, and we have a whole program that has been headed up to help to have a mentor-mentee, the cardiologist, all the different specialists. If you go in, you'll see a young resident with them, and that's the most important thing with all of it is good communication. Clinical decision making, learning through student voices. This is a little baby. This is a sonographer. This is a very steep curve doing ultrasound. So you have to learn your anatomy along with your hand-eye coordination and probe dexterity, all of this at one time. The University of Auckland in New Zealand did a program, called it Clinical Decision Making Model, so that the student sonographer has some structure in how they are able to get their patient and follow through with it to do what needs to be done. They look at their requisition first to see what they need to do, and then they encounter the patient and decide if all of this matches up, because they've already looked at the chart too. They are able to decide it's okay to go ahead with the exam, and then they actually do the examination. Then they show the results to the physician, and then they have time to reflect on if they did the right thing. All of this has a big impact on patient outcome, quality patient care. Student participation in professional organizations. There are many organizations, the Society of Radiographers, the Diagnostic Medical Sonography Society, and it is encouraging for the universities to try to get their students involved in the organizations. Most of the schools give discount rates. Some of the states don't charge the students, and it really should be a part of the curriculum. That's a real good way for students to network and to see what the real life learning cycle is about. Motivating students in the 21st century. This has become a real challenge for the educators, because these children were born with computer devices, electronic devices from birth on. So the educators, they have to have strategies and critical thinking skills to be able to engage their students. They feel like that the students are either intrinsic or extrinsic motivated. Intrinsic is from within, which when we all went to school, you felt like that's what you did to learn and be at the top of your class. And then the extrinsic ones are the ones who are doing it for good grades, rewards, maybe a good job. So they kind of they're not critical thinking, they're not thinking through it, they're just trying to get through it and get a good job. But the whole thing is that the educator has to learn how to engage with the student. I love this. This is helicopter parenting. They even have, at the universities now, they have classes for parents, how to deal with students. They have intermediaries where parents and students are kept apart. The helicopter parent is the one that hovers. They have bulldozer parents. Nothing can stop them from helping their students. They have lawnmower parents. They mow down obstacles to help their students, their child. Stealth fighters who swoop in and save the day before the student even has time to do it themselves. when they did a survey, they did say that students really do like for their parents to be involved, though. Critical thinking is what it's all about. You have the teacher-centered approach and the learner-centered approach. The teacher does lectures, homework, exams. This doesn't always work. It's better to have things like small group activities so that the teacher is lecturing for 10 minutes and the students are given feedback for 5 minutes. Reflective journal writing, debates, poster, different types of approaches that are not just classroom lecturing. Lifelong learning starts now. The American Registry of Radiology Technology exam is the one that you have to take after you finish radiologic technology school. It's gone into a degree program, whereas it used to be a 2-year hospital program. Now you have to have either an associate or higher degree to even stand the boards, which they feel like it's much better to have the student to be well-educated, well-rounded. An example of that would be in an academic setting, you've got students who have learned how to position, they know how to do all of the normal things that would come up, that they think would come up in a setting. And then in the clinical setting, it teaches them what to do with the real life, what really happens. An example of that would be a cervical spine patient that came in the emergency room that with a possible broken neck, that the student, who is very intoxicated, and the student is having to position them like they know what to do, but they also need to know and have the skills to deal with that person as an intoxicated patient so that they don't become paralyzed. This is my favorite slide. Her name is Tess Conroy. She's got a breadcrumb trail of breadcrumb qualifications behind her name, and now she has even more. She kind of got my interest because she had gone to, as an EMT, she had gone into the hospital with a patient, and she got interested in all of the medical things that were going on, asked if they had a nursing school. She was told no, but they had a radiologic technology program. So she went into it, she applied, and they didn't take many students, so it was pretty tough to get in. And in her interview with a series of doctors sitting there and people questioning her, she was asked what she would do under certain circumstances if something happened during a barium enema. And if she had actually known what a barium enema was, she probably never would have gone to school to do that. Most people do it for a little bit and move on. But she honestly said, I do not know what a barium enema is. But she got in, and she has been building herself forward with, she has certifications in many things like magnetic resonance, computerized tomography, and she's also been in the Mrs. America contest twice as Mrs. New Hampshire. And her favorite thing in her platform while she was in the Miss America contest was foster parenting. She's very active, she and her husband, in foster parenting. And her advice to students is, go out there and just do it. Have a good attitude. Do not wait on an opportunity to come to you. Go out and seek the opportunity. And I kind of kept going back to her, the write-up about her because I thought she's pretty remarkable. This is one thing I'll read because it's from the radiologic technologist. You think once you get out and you're working, you don't have to deal with teaching other people or just do your own work. But if you're not an educator, teaching is still required. The radiologic technologist continuously strives to improve knowledge and skills by participating in continuing education and professional activities, sharing knowledge with colleagues, and investigating new aspects of professional practice. And the next slide is my reference list. And I appreciate y'all being here. And if I'll be happy to answer any questions.
Very good, Helen.